basically the session is all about health and well-being. So on Mondays and Fridays we have a 3-hour session, and we have somebody coming to work with us, which is cartwheel arts. And we have worked with textile, we have worked with paint, we have worked with glass, so all forms of arts which the ladies have enjoyed a lot.
There are a lot of ladies who are lonely, even with a family, and some who are widows, or some children might have moved to other parts of the country or other parts of the world. And this is a fantastic place for the ladies to come and meet other women, and they kind of adopt the staff who come along, so they have a lovely banter here. It's like a family for many of the ladies.
I love Deeplish because good for ladies. They don't have this center. They're sitting at home thinking about health problem, this and that. They get stress. Soon they come here, they can talk to each other, talk about shopping and things like this, clothes, where to get this from. All the ladies very nice, and they can joke and take a joke, and their staff is nice as well.
हमें इसलिए अच्छा लगता है, कभी कभी एक घर में ना हम बड़े परेशान हो जाते हैं, समझ नहीं आती, खुद ही ऐसे डिप्रेशन हो गया या कुछ हो गया, तो इसलिए हम आते हैं कि जहाँ आकर हम सबको घरों में जाकर नहीं मिल सकते और जहाँ मिले।
और कुछ भी नहीं करती, बस घर में घर के काम अपनी बेटी के साथ कराती हूँ, नहीं होती। ये किसी ने बताई है तो हम भी दोहराएं। मुझे आपसे बात करना अच्छा लगता है क्योंकि मैं ज़्यादातर खामोश भी होती।
A lot of my work, because I'm working with artists, is to try and loosely connect what I do with what the activity is going to be. So the last few weeks we spent working with a doodle artist. Part of the doodle activity has been to create a box that's decorated, and inside that box we're supposed to be putting things that are helpful. So I use the theme of self-care today, which is something that some ladies might not have done for all their life. So we look at how do you address self-care, what does self-care look like to you?
I've been delivering mindful doodling workshops for the last few years. It's a mindful practice and it's really great for relaxation. I'm working with an absolutely gorgeous group of women. Their sense of humour is out of this world. It's a shame that people see this sort of stereotype with the Salvation community. There's too much dehumanisation. They don't see the human behind. It's a space where the ladies can share their stories. They are beautiful souls.
Last 2-3 weeks, they took ladies to the park, like a small picnic.
और ये कभी ट्रिपों पे ले जाते हैं या कभी बाहर फिरने के लिए ले जाते हैं, तो फिर हमारा वक्त पास हो जाता है। अच्छा, ठीक फील हो जाता है कि दूसरे को मिलते हैं ना, कि बात किसी की सुनी, कुछ अपनी सुनाई, और बस फिर ठीक हो जाता है।
Many of our ladies have given to their children, their partners, their communities, and never really stopped and looked at themselves. And I think it's a fantastic age to work with, where ladies are at a place where they hold a lot of knowledge, but they also now hold a lot of wisdom about life. We've done lots of projects around textiles where they've looked at their migration journeys and their economical journeys into this country, and then having their families and then having their grandchildren and where their life is at the moment.
It is breaking barriers in the sense that they come because this place is really local, it's a hub, and it is culturally and religiously appropriate for them. What we need to do is obviously talk to these communities to find out what they want and what they want in terms of inclusion, so that they feel included and represented as well.
The one barrier that I identify the most is the barrier of the language. People do not understand or do not know because they can't communicate what they need to know. So there are very few people who are letting people know what is out there for them. We need to reach those masses who are not aware of even what mental health is all about, and there will be plenty here. We have very new people coming into the country who are unaware of these terms and these things.
Obviously there's the linguistic aspect where there aren't linguistically competent services around, but also then there's the whole culture and culturally sensitive people being understood, people feeling heard. Historically, many of the Asian communities, specifically the ladies of this age, tend to present with psychosomatic symptoms. So they will say they've got a headache, they will say they're feeling unwell, but they might not talk about mental health. So that's one of the barriers. I think then sometimes GPs and services who are not culturally competent collude with that And then we've got people being quite depressed or unwell emotionally, but it manifesting itself in a physical way. And then there's the whole thing around stigma and shame, which I'm constantly addressing. A lot of people don't access services, and by the time they do, it's very, very late, and their mental health issues have become very acute. A lot of my education is around, if you're feeling down, if you're feeling depressed, you need to access support and help as soon as possible and engage in healthy self-help. And sometimes the community is hard to access, but more than often it's the services that are hard to access. So we have a lot of conversations about things outside Deeplish, like the GP practices and mental health services, and even leisure centres and other assets which might be available within Rochdale that the ladies might not be able to access for various reasons. The other thing is, historically, people sometimes don't go on the path of looking at services, but might try and look at what's available in the community. And sometimes that's great, because they might have some guidance through religious scholars who might encourage them to access support and look at their mental health and maybe meditate, or all those kind of things that might be useful for mental health. We need to seek dua and dawa, which is about we need to seek medical help and we need to seek prayer. And that's how I address that part of the problem, is sort of within the community.
I think we need to increase the number of such sessions where we are open to the public and where they can just drop in and get information about everything.
Well, first of all, it is funding, so we don't always know how long we're going to be working with the group for. The ladies really responded well to meditation and breath work. I think the ladies would love a kind of merging of meditation and exercise together.
I like to see in the future ladies more interested into the exercise, not hip-hop exercise, jumping, just armchair exercise.
The other thing that we've done once or twice, I think, which would be really helpful if we had more funding, is take the ladies out, art studios and galleries. It's absolutely magnificent how the ladies engage with different kinds of art, and they've got so much to say. So I think the trips would be wonderful in terms of we could still be under the umbrella of emotional well-being and art, and just walking and talking has been great. And if there was more of that, that would be really great.
This is not just an art session. For some of these women, this is a lifeline. They've really changed from when we first started doing the sessions. These groups are actually keeping them healthy and youthful.
बहुत ज़्यादा मुझे खुशी महसूस होती है, सुकून आता है दिल को.